Okay, now we talk about the surgical management of ectopic pregnancy for the PLAB2 station. So how do we address this to the patient? What do we tell the patient? We tell the patient that the aim of this surgery is to remove the ectopic pregnancy, and the type of operation that will be performed depends on your wish or your plan for a future pregnancy, and what the surgeon finds during the operation. Now, this specific type of surgery is called laparoscopy. Okay, then over here, because you have introduced a term laparoscopy to the patient, it's very good that you give a pause and ask the patient, do you have any idea about it? Have you ever heard this term before? Okay, don't worry, I will be explaining it to you in detail. Okay, is that okay? Or again, you say that, do you want me to explain it to you in detail? Yes, okay. So then you tell her that this laparoscopy, which is also called a keyhole surgery, the aim is to remove the pregnancy before it becomes too large and it is life-threatening for you. And the surgical approach is also performed whenever the heartbeat is present, because when the heartbeat is present, the conservative management, it can be dangerous. You can't let the pregnancy grow because there is a risk of rupture. Okay, so what happens during a laparoscopy? So you tell the patient that you will be given a general anesthetic, which will put you to sleep, so that you don't experience any pain or you won't remember what happened during the operation. 3 small cuts are given, hardly an inch, and they're made in your tummy, and there will be a small tube with a camera which is introduced in your tummy, and some small surgical instruments that will help remove the pregnancy. Okay, and then depending, now sometimes we may require to remove the entire tube which contains the pregnancy, and this procedure is called salpingectomy. Okay, and in other cases only a part, that is the pregnancy is basically only the pregnancy is removed where the tube is left inside, and this is called salpingotomy. Now if the other tube is normal, healthy looking, then it is preferred to remove the tube with the pregnancy. Okay, because removing this tube will not reduce your chances of getting pregnant again as long as the other tube is intact. Okay, now there are cases where the other tube might be damaged, or for the patient's wish and the patient doesn't agree to remove the entire tube, only the pregnancy is removed whereas the tube is left intact. However, this tube from which the pregnancy is removed through the process which we call a salpingotomy, it still holds the chance of an ectopic pregnancy in future. Okay, and that is why if the other tubes is healthy looking and it's normal, then it is preferred to remove this tube with the ectopic pregnancy in it. Okay, yeah. So so removing the affected fallopian tube is the most effective treatment, and it is not thought to reduce your chances of becoming pregnant again. Most women can leave the hospital a few days after surgery, and although in order to fully recover and resume your day-to-day activities, it might take up to 3 weeks or 4 weeks. Okay, and another important point is, which the examiners might like, is that you tell the patient that after the surgery, if your blood group is negative, for which we use the term Rhd negative, then you will be given a specific type of injection which is called antidiuresis prophylaxis injection, and this will protect your future pregnancies. Okay, again, you give a pause and you make sure that the patient is following you. Then you may discuss the complications with the operation. So just like any other operation, this surgical procedure is also associated with some complications. However, we will always be there for you, and we make sure that none of these complications happen. And then the complications which you always tell, like bleeding, infection and all. The important point to remember is that whenever you tell patient about a complication, you always have to tell the treatment with it. Like, for example, infection might happen, but don't worry, we will be giving you antibiotic cover throughout this procedure, which will prevent the infection from happening. Okay, so forth and so on. So yeah, that's how you tell them, or you let the patient ask the question that, do you want to know anything else about the surgical procedure? And she might say, oh, if there is any complication associated with it, and so on. Okay, so yeah, this is about the surgical. Now we will move on to the important questions that the patient might ask. Okay, the first question, the patient might say that I have to go for a job interview, and which the patient in PLAB2 exam, by the way, for the past few years, they used to ask this question, that I need to go for a job interview and I cannot stay and I'm not having this surgery done. So what do you do then? Do you agree to the patient because she has the right to make this decision, or do you convince her? So you convince her, because this is a life-threatening situation, and you tell her that I understand how important the job interview is, how important career is for one, but it is still not as important as your life is. Okay, if we don't manage it on time and we don't carry out the required treatment, the pregnancy may end up rupturing, which will lead to bleeding. Okay, and it will be an emergency situation, and it can be life-threatening for you. Okay, in that case you will need an emergency surgery, and this instead of going for a laparoscopy, which is a keyhole surgery, we might have to make a larger incision in your tummy, which is called laparotomy, in order to stop the bleeding and the damage that might occur because of the rupture of the pregnancy. What we may do is, if you want to have a letter from the hospital that might help you with the interview, so that they know you are unwell, and the reason why you skipped the interview, that might be helpful for you. But at the moment, it is more important for you to stay here and undergo this surgery. Okay. Again, she may ask you the question, so what will happen, doctor, if I don't have the surgery? What's the worst that could happen? Again, as I discussed with you in the previous question, you just tell them that it may rupture and the emergency surgery may be required and laparotomy might be carried out. So it depends what form of question she asks you, and then you answer her. Okay, recently I heard that they asked the question saying, I don't want to inform my parents about the surgery. So what do you do then? Do you tell the parents or not? So it depends on the age of the patient. If the patient is 18 or plus, yes, you keep the information confidential because she has the right to. And in most of the cases, I think in scenarios, she was 18 plus. So you tell her that, of course, you don't need to worry. Every information here is confidential within the team who is managing you, and none of the information will be shared with anyone without your permission. So you reassure her about the confidentiality. Then what will happen to my pregnancy? Will the baby survive? If she asks this question at any time, I have already explained it while explaining other answers, that unfortunately this baby cannot survive because the tube is not the right place for the pregnancy to grow. Okay, and then you tell her about the outcomes of the what would happen if we let the baby grow.